So today we're here in St James's STI Clinic. Ellie and I are going to get tested just to show how easy it is.
Anyone who's sexually active is at risk of contracting an STI, so should be tested. It costs nothing and everything is completely confidential, so you don't need to worry. All you have to do is show up the day the clinic is running.
When you arrive, you'll get a ticket and they'll call your number when they're ready. Then you'll have to fill out a form to register with the clinic, and don't forget, if you're a guy, hold off and go into the toilet for an hour beforehand.
Before we get tested, we're going to talk to Grainne about some common STI myths.
So firstly, if I had an STI, surely I'd know about it.
Not necessarily. Not all sexually transmitted infections actually have symptoms, so you wouldn't necessarily have any physical signs.
And what if I'm on the contraceptive pill?
The contraceptive pill just protects you from pregnancy. You need to use condoms if you want to protect against sexually transmitted infections.
If I had an STI, I'm worried that would prevent people from wanting to have sex with me.
Well, the most important thing is that you have a test, and then you know if you have a sexually transmitted infection, then you can get treatment for it. If you are open with new partners, good to have the conversation about testing, and then you can both get tested and start from a level playing field.
What if I've only had oral sex?
So there's still a risk of sexually transmitted infection even if you've just had oral sex. Because there's a lack of penetration doesn't mean that you're immune from STIs.
Okay, so will we get started?
Yeah, great.
So how exactly is this going to go?
So first of all, I'm going to ask you a few questions about your sexual history to make sure I'm doing the right test for you. And then I'm going to take a blood test. And then I'll explain to you how to take your swab test.
And is it going to hurt at all?
I'll explain it to you and you'll take your time doing it nice and slowly, and it shouldn't hurt. The blood test just feel a little pinch, but there's just one sample, so it's over very quickly.
So as a guy, how exactly is the test going to go?
So first of all, I'll just ask you a few questions about your sexual history to make sure that I'm doing the right test for you. And depending on your answers, I will do a test for a heterosexual man for a blood test and a urine sample. For men who have sex with men, we take a urine sample, a blood test. I would take a swab from your throat, and I'd explain to you how to do a rectal swab yourself.
And what STIs exactly are you testing for?
We're testing for chlamydia and gonorrhea from the 3 sites, from the throat, from the urine sample and from the rectal swab. And the blood tests are checking for HIV, syphilis, hepatitis B and hepatitis C. So are you ready to get started?
Yeah, let's do it.
So that's everything.
Okay, great. And what happens next?
There's 2 options in terms of getting your results. The first is that we would call you if there's any problems with any of your results. If you don't hear from us after 2 weeks, everything is okay. The other option is that we can make an appointment for you to come back and get the results in person if you'd prefer to do that.
Okay, brilliant, thanks. So we're done here at St James's Clinic for today.
Now we just have to wait until we get our test results back.
So we're back here at SpunOut HQ. It's been 2 weeks since we got our tests done and we haven't heard anything from the clinic, so we're safe in the knowledge that we're infection-free.
As you can see, getting an STI screening is super easy. Getting bloods taken is nothing more than a pinch, and there are loads of free clinics around the country. You can click here to find your own local clinic.
Some clinics even have a service to contact your former partners in case you don't feel comfortable in doing so yourself. Most STIs are totally curable and all of them are treatable and manageable with the right treatment. So guys, if you do have an infection, it's not the end of the world.